So Dr. Rob, we have questions. I don't know if you, I'm gonna hit answered so that you can see it. So married, the first one is married 39 years, 3 years sober for husband who has suffered from depression our entire marriage. His depression has gotten worse since the walls have come down and he sees the damage he has done. I have made great strides through this, but dealing with the depression is dragging me down. Feels like depression is just as selfish as SA is. Any advice on how to use the codependence model for depression? Thanks for all you do.
Well, what first comes to mind, and I think this takes a little bit of thinking and work, is there's a big difference between shame and depression.
Yeah.
You know, depression is a chronic, you're depressed in the morning, you're depressed in the evening, you're depressed when you wake up, you know, you don't have a lot of energy for stuff. Sometimes men can get angry, sometimes we can get sleepy and sad, you know, all the usual stuff. But that's very different from when we are reminded of something that we did badly or some way we've hurt you. And then we kind of go into shame, and it looks like depression, but it's really more like, I hate myself. I can't believe I do this. What was I thinking? I'm a terrible person. And you're right, that part is selfish because in fact, I'll just say we read impact letters at the treatment center. And so I will always ask a spouse to send a letter about what you have experienced with your husband. And then we will read, or your partner, and we will read those in group. And it really shocks me the amount of, first of all, the amount of pain that you guys are in and the amount of pain that you put up with, and things that I didn't even realize you were putting up with, like a lot of anger and angry acting out, breaking things, yelling, you know, that makes me really sad. But in any case, one of the things we do when we read this impact letter is, of course, the man whose spouse it is kind of looks down, they're sitting in group, they don't want anyone to see them. And when you say what's going on, they say, oh, I hate myself, I'm a terrible person, I can't believe I did this. What kind of dad am I, all that. And you're right, that is selfish, because it's, you know, what I say to them is, I'm really sorry you're crying about how awful you are, and I'm really sorry you feel so terrible. But that is not the same as saying, I can't imagine what my family's been through. I can't imagine the pain my wife is in. In other words, turning that pain inwards, it's narcissistic. Selfish is a common word for it, but it's all about the collapse of me. I collapse into myself when I can't tolerate something that upsets me about myself. So the question for you is it really depression, or is it more related to the situation? And situational things are different than a chronic thing like depression. Tammy, do you have thoughts?
I would, so let's talk about chronic depression, like like the medical version of, a depression, and how would you distinguish between that versus what you've just shared? And what would you suggest they do if that is actually the case?
Well, since you said that, you know how I am. I just looked up depression, so that here's a self-assessment. So I agree, fine. Loss of pleasure in doing things, feeling down, depressed, or hopeless, having trouble falling asleep, staying asleep, or sleeping too much. These are typical sort of criteria by which we define major depression or emotional depression that requires treatment. Having very little energy, feeling tired a lot of the time. Poor appetite, either under eating. I just worked with someone who lost 10 pounds in about 3 weeks, or overeating, just constantly trying to comfort yourself. It's about extremes. Too much sleep, not enough sleep. Feeling pretty much down about everything, not enjoying things, feeling badly about yourself, or that you are a failure or have let your family down. Now that is something we feel when we have been acting out and we get in trouble, but it doesn't mean that all those other symptoms are necessarily there. I'm almost done here, Tammy. Let's see, other signs of depression. Trouble concentrating on things like reading the newspaper, watching TV, just kind of get distracted or lost or can't follow it. Moving or speaking slowly so that other people might have noticed, like you're kind of, like that. Or the opposite, people are really fidgety, really restless. And men and women can be different in this way. Men can tend to express our depression in more active ways. And so we don't look depressed, we get angry, we get irritable, we get demanding, more than usual. And but you ladies, you tend to get depressed by getting in bed and crying a lot. And it's just a different presentation of it in different genders. You thought that you would be better off dead or disappearing or hurting yourself. That's pretty much it. So to me, it's really about functionality. how much is this inhibiting your sleep, your eating, your ability to relate to people? And it's chronic. It's like Tammy said, I don't just hear what I did with you and have you get mad at me and go to bed early and then wake up okay and I'm depressed. I'm depressed if I wake up self-hating and can barely out of bed and I'm angry and irritable all the time. So it's just a difference between being chronic and situational. I'm sorry that took so long.
No, that was really helpful. And, if for somebody who has chronic depression, then having a qualified professional who understands addiction totally do a good assessment and evaluate, and then possibly put on medication just to, raise the bar to more neutral, but it also, my other question is, curiosity is, what is this person doing for their recovery? Because if they're actively engaged in recovery, then, the reality is, if you're in recovery, you're doing things for other people, you're working on a program, you're working on bettering yourself, and you start to feel better, unless you're clinically depressed. So
you're less isolated.
Yeah, because you're starting to go, okay, yes, these things I did, were not helpful and they were hurtful and all those, but I'm going to be able to deal with those one piece at a time, if I do the work. But if somebody is, I'm going to use wallowing in not doing anything and using I'm depressed as an excuse not to do anything, then either they're wallowing or they really do have clinical depression that, should be, but getting somebody who's actually expert at helping diagnose what is really going on, may be useful. But
I just want to add one thing, Tammy, is that depression, the kind we're talking about, is a biological issue. So, I remember I did go through a depressive period. And if you think about all these things, sleeping or not sleeping, eating or not eating, being obsessive, these are all biological symptoms. And feeling shameful or uncomfortable and happy doesn't leave your body changing. I think people are depressed. I lost 15 pounds. I didn't want to talk to anybody. I didn't want to do anything over the weekends. It was that kind of thing. And I had to take medication, not because, I needed to be on medication, but because my body and I'm talking about hormones, the functionality of my brain, my physical body I couldn't get out of it. I couldn't get out of it by myself. I needed something to sort of give me a foundation so then I could do better with my life. And so it's biological.
Yeah, but getting the right diagnosis changes things. It's like with sex addiction, we talk about, I have lots of calls for people who have been to multiple treatment programs for alcohol and drug abuse, and nobody has talked to them about their sexual acting out, which is often primary issue that is, hasn't been treated. Well, that's why getting the right diagnosis leads to better help and treatment. So, okay. How concerned should I be if my husband just told me that he used to watch incest porn? Do men who watch this typically act out on their own children?
Well, I mean, it's just, when I hear a question like this, regardless of the outcome or what we have to say, it makes me sad, because whatever this person is looking at is disturbing. And then the fact that they're looking at it is disturbing. And it just makes me, it's just a whole different level of concern and of kind of discomfort that I have just reading the question. But Tammy, I'm glad to start, or if you want to.
This one, I want Dr. Rob, because this really is, it's what's legal, what's not, like all of those, type of things. I think it would be helpful to talk about, offender behavior and not offender. And, and we have talked before about, as I say, I want you to start and then I start, but we have talked about watching porn doesn't necessarily mean that they're going to act out on it, but is there something, I'd be concerned just hearing what they're watching too. But I think it would be helpful for Dr. Rob to talk about, does watching this type of porn lead to, problematic behavior? So
one of the things I wrote down, because I wouldn't remember this, is why did he bring it up? What made that come up at the dinner table? Question. Yeah. And I don't know, just that alone, like you've been married for a while and you've had kids and all of a sudden you hear about this. That makes me uncomfortable. Like I wonder why now. That's always a question we have as therapists. But so what I don't want to do is have all the spouses say, my kids are unsafe. My husband's a sex addict. My my wife is a sex addict, and I've had women do these things to kids too. So in any case, I really want the spouses to understand that it is highly unusual. In fact, I don't think I've ever run into a case where a sex addict has crossed a line with their own children. I don't think I've ever experienced that. It's not to say it doesn't happen, and that people certainly they do these things, but in the world I live in, which is pretty functional people who are living lives and have families, and they generally aren't the kind of person who would do that in particular. However, um, so what I'm saying to all of you spouses of sex addicts is, please, you often say to us when we figure out sex addiction in your partner, oh my God, what about the kids? And it's like, really, that is a very, very minor concern, although I completely understand it. And you should discuss it with their individual therapist, them, you should speak it to them, all your concerns. But this is a different situation. This is someone who's actually not just looking at porn regularly, having affairs, all those things that drive us to addiction treatment. This is something that concerns me. If my spouse looked at this kind of porn, I would be concerned about my kids. And that's so let me explain the difference. I work with men who've crossed the line into underage porn. They've looked at 16-year-olds. Some have looked at younger. I go to court. I'm an expert witness. So I often write reports and go to the court because a judge doesn't understand, when he's looking or she's looking at an image, they're just so horrified by that. They don't understand that there are many different kind of people who do this. So when someone is compulsively looking at porn, and if they were to escalate or focus a lot on child porn, I probably would not be as concerned as in this case. But your spouse is looking at incest porn. It's not just underage, it could even be adults, but that doesn't make me feel comfortable. And I would definitely want to say, hey, we need some therapy, because I want to sit down and understand, if you're not, either one of you are not, why did you look at that? And what does it mean for our kids? And it's not something I think you're going to get resolved, just the two of you. But I think this does concern me. And for some reason, it concerns me that he brought it up. And by the way, in these situations, I wouldn't just be worried about your kids. What about the babysitter? What about them? What about the teaching aide or the teaching assistant? What about the camp, someone at camp? I mean, there are lots of people who will get, there are lots of situations where someone will act out if they're this far along that isn't necessarily with their kids. So, Tammy, I just said a lot.
I do. Yeah, no, but I think you touched on it too, was the adult. I mean, it doesn't, like, my mind went immediately to children, but that doesn't necessarily, right. I mean, incest does not necessarily mean children. I think it would be really important to understand exactly what it was. And that I used to do this, like, to me, if this person, has some addiction traits, they're lying, they're minimizing. So it would be like, I used to do this. Was that last week when I used to do that? Or was it, in college? I mean, like, I would really want to understand, and what else is going on. So having, again, a qualified professional really assess and help identify what's going on for each of you, would be really helpful. And so you mentioned you do legal consults. He also does 2-hour, like, one-time expert consultations for couples that can be really helpful in identifying the issues and guiding next steps. So, it's only 2 hours. It's not therapy or treatment, but man, a lot of couples have really found it validating, eye-opening, informative, guiding, whatever, so that could be something too. But I would get some professional help about that. So
I want to add one more thing, which is that you can't say the porn made me do it. There are some people who say, oh, I never had this interest in trans this, or I never had this interest in S&M that until I saw the porn, and I watch it so much online that I became hooked on it. There are people who didn't realize there are parts of themselves that were kind of unconscious, and they didn't know where they were into guys, or they didn't know they're into this and that. And then they see the porn, and it's not like the porn made them do it. It's that a part of them wakes up and says, oh, I'm kind of interested in that too. And so we may not always be aware of what is under the surface. What I wanted to say about all that, though, is if I had a spouse come to me and said, my husband looks at gay porn a lot, should I be concerned about that? Or my husband looks at, I don't know, S&M a lot. Should I be concerned about that? And I don't know. And I know that if I'm into S&M, it doesn't go away. It's still in my brain. If I'm into gay men or whatever, if I watched it, it's still a part of me resonates with that. And so obviously, even though it's used to be, there's a part of him that was aroused by this. And I think there's a lot more information. By the way, I'm glad you're asking this, because I think it is of concern in some way. I don't know what that means, but I really, and by the way, excuse me, if you guys don't have a therapist or don't have a useful psychiatrist, we work with people all over the country. I've done a lot of training. Tammy's run endless trainings. Just write Tammy, Tami, at seekingintegrity.com. Tammy gives out, as she says, probably 100 referrals a week. So we are here to do that. We don't get kickbacks, but we do know, a lot of you say, I want to see a CSAT. We want you to too, but I want to make sure it's someone who really is on the ball with their work. So anyway, Tammy, thank you for making all those referrals.
Yes. Well, yeah, I want people to have the right fit for help. And some of the CSATs I would refer to, I would go see myself, and others I would never refer to. So like it really does make a difference. So I know I just said it out loud and it's recorded. Okay. Hello, Dr. Rob and Tammy. 35 months since D-Day. CSAT every other week, goes to SPAA meetings twice a week. Denial and acceptance still there. So I'm thinking non-acceptance, denial and non-acceptance are still there. So much that when we check in, we end up fighting due to his inability to accept himself and inability to validate he did those things to me. He says he understands the impact his actions had on me. Well, seems impossible, seems to me, due to shame. Should I not expect him to be more empathetic at this point, less defensive?
I want to answer this question, but I also want to say we get this question a lot in various forms. Like, my spouse has stopped acting out, but why are they still an asshole? Why are they still so narcissistic? Why don't they understand how to give me empathy? Even if they're sober, I think this is not an unusual thing that men in particular struggle with. And I wrote a book about this for men to have understanding and empathy. We also teach a course. It's called Out of the Doghouse, which is where we are if we cheated on you. And there's a lot about, I don't know that innately some of us will be able to fully feel empathy. You understand, if we didn't get empathy, it's hard sometimes for us to express it. But what I've noticed is, and why I wrote the book, is I can teach someone how to act empathically. And when they do, they get a positive result. And so the more empathic they are, the more positive result they get. It reinforces itself. All of a sudden, they've learned how to be empathic. It's kind of like a little trick. So if you want to learn how to act empathically, so you can, walk your way into running, that's what Out of the Doghouse is. And we teach a course, and I wrote the book, and Tammy knows this. It's my most popular book because I think a lot of men struggle. It's just about cheating, not just sex addiction. A lot of men struggle with, how do I get you to forgive me, as opposed to how do I come to peace and understanding with what I've done to you. So in answer to your question, yes, he should. This isn't a month or two. This is 3 years. I would, what did Tammy, we talk about dry drunks. Can you say maybe a little bit about that?
Well, so people who quit drinking but don't really change, and that's where I was going with this is, seeing a CSAT every other week, going to 2 meetings a week. So I mean, that's a minimal input for a 24/7 issue. But yeah, so the dry drunk is, if I just stop drinking but don't change anything, that's a dry drunk. And ultimately, I'm not happy, joyous, and free, and probably still wreaking havoc. But I wanted to tag on a couple of things. So one of the things you put in here, and I just want to unpack this, accept himself and the inability to validate he did those things to me. And I'm wondering if we could reframe that a little bit, is he did those things and they had a huge negative impact on me. So rather than, you did this to me, your behavior has hurt me, it hurt him. He's a broken person. You've been around here because you've been around here. So codependence. You love a broken person. What I hear is somebody who's not doing enough. Dr. Rob has talked about this before. Is like, if this isn't working, do more. This is like seeing a CSAT every other week and going to 2 SPAA meetings. You didn't mention what step he's on. He should have been through the 12 steps, ideally no later than the first year. And what steps is he, continuing to work? Is he working 10, 11, 12? If he's just attending meetings, that's called warming a chair, but it isn't really doing the work. You have to do the steps. You have to do the work. Nothing changes if nothing changes. And I'm just reading this, so I don't know. And, you could probably write a novel on all of this. The other thing I wanted to key in on is, like, when we do check-ins, we fight. And I was like, then why have you put yourself through that? The point of a check-in is to increase communication, so I'm wondering if there's a different way to do this. Maybe it's time for the two of you to be working with a couples therapist, just to have some language to use. Is there a time when you're not doing a check-in where you can say, this is a bad dance, we're doing the negative 2-step, and we don't want to keep doing this dance? Can we do something different? How can we, rather than having this escalate and keep doing the same thing over and over again, how can we do this different? How can we vision having a better relationship? But so all of that to say, way more for him. Yeah, I would love him to participate in the Out of the Doghouse, work group. And that still wouldn't be enough. We have drop-in groups for men, I don't know, 5 times a week, so there's opportunities. Yeah, they're all free. But listening to a podcast, the two of you, and then discussing, what does that mean to you? Having a discussion. But I'm wondering, because you have more emotional maturity, if you can go, I'm not going to fight. I'm going to be curious about this, but I'm not going to engage in the fight, because otherwise we just keep doing this thing. Is there a way for you to, step back, hold healthy boundaries? We're not going to do check-ins until we can do it in a way that's meaningful and helpful, so that's.
Tammy, I appreciate your saying that point about to me, because I actually wanted to jump off that since you brought it up. Part of what's going on, I think, is that sexual and romantic betrayal is so personal. How could someone not be doing this to you when they've ruined your life and they've had sex with other people and they've been looking at porn 12 hours a day? Of course, it's so personal. And I wouldn't take that away. But if you put it in terms of addiction, and please forgive me for this, if I got a DUI because I was drinking so much, and I came home to my spouse, or I had to have them pick me up in jail or something, they wouldn't say, you did this to me. They would say, I can't believe you're doing this. It's ruining our lives. You could have killed the kids, whatever it is. But when it's alcohol, drugs, gambling, it isn't so much, it's a nightmare, but it's not in that personal sense. And I'm not saying you don't deserve that personal sense, or it isn't accurate. I'm just saying it's harder to see this issue. It's harder to not feel it was done to you when it's a form of addiction that is so personal. Did I say that right, Tammy?
Yeah.
Okay,
yeah.
good.
Well, yeah, yes. But at the end of the day, whether it's alcohol, gaming, gambling, cannabis, sex, porn, whatever it is, it's still the brokenness of addiction. I'm looking to fill the hole in my soul. So I'm using something, and it's, bitterly personal to betrayed partners, because here's the thing, and I tell this to partners all the time: you can never understand an addict brain, because you would never do that. You would never do that. You can't even, like, your brain can't, do the crazy stuff that an addict brain can. And it's not an excuse, it's a reason. But again, does an addict intentionally do something to a partner? I think it's a rare person. It's more about, I need to do this. I'm so compelled to do this. This is my coping mechanism. And so I'm going to do this despite the negative consequences, despite the hurt that I'm causing my partner, myself, my relationship, everything. People lose jobs. There's a lot of devastating things that happen within this addiction. So yes, it feels incredibly personal, but you guys are in a 3-year negative spin. So is there a way to shift things just a little bit and maybe start to see things move in a different direction? It feels like you're stuck, and something's got to get unstuck. So I hope for you.
Why don't you go ahead? I'm pulling something off the internet for you, okay. Tammy. Give me 1 second.
Okay.
I'm going to send this to you. Hold on 1 second. I want to just send this to you real quick.
Okay.
Because I think we should mention this. You are probably the host and the panelist. Yes.
Yeah. You're sending it through chat?
Yeah.
Okay.
Okay, so I couldn't do that. So I will just say to you, I want you to please mention the new Ken Adams book about children of sex addicts. I was going to
Yes.
put it in the chat, but I couldn't find the link.
I know
We've been
right where it
asked
is.
this
I'll
question
find it. Yeah.
forever.
Yeah. Yeah.
So just briefly before we move on, a colleague of ours, a gentleman who wrote Married to Mom and those books about maternal enmeshment and how it plays out in adult relationships, Dr. Ken Adams has written a book which we just didn't have anywhere in the literature, which is what do you do with a kid whose father is a sex addict or whose mother is a sex addict? What do you tell them? What if they find out? What does it mean for them? What do they worry about with their kids? This is really, we get asked this all the time. Sometimes it's in anger, like, gosh darn it, I'm so angry at you, I'm going to tell the kids. Not a great idea. Sometimes your kid walks in the room and they find porn, and that's what it is. So we really needed a book in this area, and thank you for letting me interrupt, Tammy. But it's just coming out, and if you do have children and they have been aware of these issues, and I'm talking about adult children and younger children, you may not read it to the younger children, but it'll help you have an understanding of what they're going through. So I just want to announce it because Dr. Adams just put that out there, and I will forget.
Yes. Yeah. So this has nothing to do with the previous question. This was just
No.
a pause to share. So it's called A Light in the Dark, The Hidden Legacy of Adult Children of Sex Addicts, a groundbreaking book detailing the unique issues experienced by adult children who grew up with sexually addicted parents and offering a path to unburden their shameful legacy and embrace sexuality and intimacy without the intrusion of or constraints from the past. So that's on Amazon. I put the Amazon link. It's pre-ordered. It's not coming out till February of next year, but he's going to do a podcast with Dr. Rob early next year too. So stay tuned, but great resource.
Thanks, Tammy. I didn't know. Yeah, I just came across it. So let's keep moving.
Okay. So next question. Me and my wife are getting so fatigued from this recovery process. It's one step forward and two steps back. I'm owning it's on me being the betrayer. This don't seem to stick. I've stopped sexually acting out for over 2 years, but still get caught out with lack of honesty and transparency. Why is this part so hard for me to get right? Honesty and transparency. Welcome to addiction. So, I'm not saying that sarcastically. Yeah, I'm like, that's
yes, you are, but that's okay.
No, it's the truth. It's like, welcome to addiction. So,
Yeah. I just want to, so being a sex addict, one of the greatest challenges for us, and it's interesting that it is being assertive. When I get mad at you, the logical response is not to go out and see a sex worker. When I have a fight with my boss, the logical thing is not to go out and get a sensual massage. So we don't say to you, I'm angry at you. We don't say to the boss, I'm disappointed. Or if we don't get our point across, we run to do something else. That's passive. Being actively engaged with you and telling you I'm upset or what's going on or whatever it is, not in a yelling, screaming way, but actually saying, this is bothering me. We're not very good at that. And a lot of it goes back to early life when no one would listen to us. And so what was the point? Or some of us had abuse and we learned, oh, if I tell the truth, someone's going to beat the crap out of me, which has happened to a lot of people I work with. Why would they have learned to be truthful when truth was going to cause them physical or emotional pain? So there are some reasons from the past, and we don't need to talk too much about why that happens. But I think it's understandable that plus we've been lying for so long. And we don't want to upset our spouse. Hey, our spouse has been upset enough about all this stuff we did. And the last thing I want my spouse to be upset about is that I forgot to take out the garbage. I've already been through 2 years if I ruined their life. And it's true. However, you can clean this up. Tammy would be interested in my using this, talking about the 10th step. We have in our 12-step programs, which is really, if you want to know what that is, it's a way of living. It's simply, I didn't get particularly good teachers. It wasn't their fault, but this is a guide to what do I do here? And how do I do that? And what if I want this? I think the 12 steps are really helpful in that way. And one of the most important ones, once you've done a lot of the hard work, which you'll have to do again and again, is reviewing your day each day and saying, is there anything I don't feel good about? Is there anything I want to clean up? And I think you could put this into action with a spouse. What I've done with clients, and I certainly would suggest it to addicts, is if you really can't be transparent in that moment for whatever reason, have a discussion and make a commitment to your wife in this case that you will go back to her within 24 hours or 12 hours or whatever it is to tell her the truth. So she may say, did you take the garbage out? And actually, I forgot, but I'm kind of running it to the curb when she's not looking. The next day, you need to go back and say, you know what? I didn't want to get you mad at me, and I just cheated on the garbage. I lied to you about it. I'm so, so sorry. And by the way, you have to do that. You have to do that because you don't understand that if you lie about the garbage, that your spouse will say, if they're lying about this little thing like taking out the trash, imagine what else they're lying about. So it's hard for us to understand that by maybe ducking it, we'll be fine, but we're not fine. And it's a really bad idea because little lies mean a lot when you've been breaking trust all over the place. So in any case, I would not go into your past for 20 years trying to understand this. I would find a simple technique like, I may not say the right thing or but I'm going to come back in this period of time and I'm going to tell you. By the way, this does not count for acting out. Acting out is something you need to address pretty quickly. You need to talk to your sponsor, you need to get through, or your therapist, you need to and the reason for that is so you can not run to your spouse and say, oh my God, look at what I did. You need to kind of be in a different kind of place to talk to your spouse. But other than that particular thing, which I think they need to know about as quickly as possible, setting a 24-hour rule, I think can be very useful for couples.
Well, and we mentioned this in a previous one too. What I don't hear is what you're doing. We're fatigued from this recovery process and you stop the acting out, but that's just addressing the symptoms. So the acting out is this. So what's the underlying issues? And it's not about, figuring out all your childhood trauma from 20 years ago, but like when I'm anxious, I want to act out. When I'm depressed, when I'm happy, I want to, whatever it is. It's like, so how, what is your relapse prevention plan? What are you doing? How many 12-step meetings are you going to a week? How many, I put the link, there, a dear friend of ours did a video series going through the 12 steps, and she unpacked word by word I've been doing this a long time, and there was some great insights that she shared with me. Dr. Rob mentioned like not having the tools when we first started. Last week I was in a 12-step meeting.
Hold on, Tammy, you talked about a really wonderful thing, but you didn't exactly, maybe everyone doesn't know where to find it.
I put it in the chat.
Okay.
But
just want to make sure they can.
Yeah, so it's on sexandrelationshiphealing.com, and that video series is under the video resources. Under resources, you'll find it. You can always email me. But she really unpacked it. But I shared, so I can say what I shared, but I shared that I didn't get an owner's manual when I was born, and the 12 steps gave that to me. And the people in the 12 steps taught me how to read the paragraphs in the owner's manual. Like, if you got an automotive one, like it tells you to do these things to, change oil or whatever. And they told me how to do those things. And so you need other people. If you and your wife are only doing this together, it's no wonder you're fatigued. Your spouse deserves support. We have lots of betrayed partner groups on sex and relationship healing. I'm trying to point my finger. This isn't holding as well today, and then we've got the men's drop-in groups. Those are one thing. 12-step. The sex addiction 101 work group, the porn addiction 101, out of the doghouse. We've got the inner child. We've got attachment ones. We've got so much good work, on those work groups that help you do some of that deeper work and make, sense of things, of what's really triggering here. So, but if the two of you are just, navigating this and, going back and forth, it is exhausting, and you're not ever getting a break. So having a plan, we've given lots of tools on these webinars of like having a 20 minutes, 2 or 3 times a week. And this is when we talk about these, telling the truth and telling it faster. Dr. Rob talked about the 24-hour rule. Great. I mean, there's so much, just learning to implement a few simple things, starts to shift things. And then people start to build trust and they start to have more hope. So recovery is awesome, but it's not simple, and it's not I did it for X amount of time and now I'm all better. Unfortunately, it's a lifelong process. So,
and I want to add again, Tammy, you always really trigger things for me that are helpful. You said, I'm owning it's on me being the betrayer. Okay, what are you doing about it? It's not enough to say, wow, I have this issue. Are you bringing up in therapy? Are you going to groups? Are you making new boundaries with your spouse? Do you have a sponsor? Because this is exactly what they're for. And so I am the betrayer. I'm taking responsibility. Great. But words, not so much. What are your actions around this? And, you know, you have lots and lots of choices. So, but I wouldn't sit in this. I would actually do something about it. So hopefully, and by the way, why is not the right question. Why is this so hard for me to get? It's not who cares why? What matters is how can I get this right? How? And that how are skills you can learn. Why? And I say this to Tammy a lot. I could show someone an entire film of their whole life since they were 0 to 25. It'd be a long day. And they still wouldn't be able to stop acting out because knowing is not the same as changing your adult behavior. So anyway, I'll throw that out there.
No, I agree. And I use that a lot too. How is a far more useful question than why. So hello, Dr. Rob. I'm a porn and chemsex addict in recovery. Yay. Sober from SA for 2 years and still struggling with porn addiction. Sober 3 weeks. Yay. Yay. I have performance anxiety and ED issues and have had them even before I became a chemsex addict. I'm working with my general practitioner for anxiety using SSRIs, Wellbutrin, and plan to visit urologist soon. I can diagnose physical causes, if any, so I can confirm that it's only psychological. How do I responsibly disclose my past SA and PA with the urologist? What tests I can get the best possible help? So
right. So one of the things is I really appreciate you're talking about having had issues that were sexual before you really started acting out, because a lot of, and this is helpful also for spouses, is that most of us were doing in some way what we did to you long before we met you. You know, I was acting out at 14, to be honest with you. I didn't get in a meaningful relationship till I was 23, but that's how it was. And that's what I did. So I'm glad that you're talking about the past and other issues before this sort of showed up. It's interesting because you talk about working with your GP, going to see a urologist, and I don't know, but I would assume you're seeing some kind of therapist or getting some kind of support. If you're not, Tammy, I'm certain we'll touch on that. But and the reason I'm glad you're going to those people is, as a good therapist, I will always say to someone like you, let's make sure the physical is checked out. Let's make sure before we get into all of the other stuff that your body is working in the right way, because sometimes it isn't. And we could spend 3 years in therapy and you just really need to see a doctor. So I'm really, really glad to see that those are the right decisions to make, I think. But what do I tell my urologist? To me, that speaks to shame. You know, to me, that speaks to your shame, because what I would do is I would go to my urologist and said, you know, when I was a little younger, I had sex with hundreds of people and I had an awful lot of sex, and it's part of some issues that I have. But I'm wondering, you know, could my prostate have been affected? Could I have harmed myself in some way? Could I be dealing with, you know, outcome of that? Or could it be escalating problem I had before? So, you know, I think honesty is the best path. And believe me, this is one of the most important things that we do with our physicians is we trust them to listen to us confidentially, which they are required to do. And Lord knows they hear everything. When I feel, and that's why I said it's shame. There is, believe me, a urologist, other than the proctologists, there's nothing these folks haven't seen or heard. So you are doing yourself a disadvantage by not by having the discomfort, but by not talking through it. And by the way, you might write a little note and you might say, this is what I'm dealing with. And you could send it before you go or pass it. You know, you don't actually have to say it out loud, but it does have to be said.
And I like you want to get the right diagnosis. If you aren't truthful, the urologist can only work with what they know and see. So, and you talked about the porn. You stopped it 3 weeks ago. Typically, it's not just porn; it's porn and masturbation. So, I would make sure you talk about that, because that, you know, can affect things, you know, as well. So, you know, I'm always upfront, you know, and it's different, but I'm always upfront with all my doctors, you know, because I want to make sure that they understand who I am, what my personality is, what my issues could be, so that they can give me the best help that they possibly can. So I love that you're asking the question. I love that you schedule an appointment. Just be truthful, get the right help. So, okay. Next question. I have trouble understanding when my husband says to me that he would lust an image on paper and one in a movie were different for him. A woman in a swimsuit in a newspaper and one on TV seemed the same to me.
Sorry, hold on a second. Got it. Sorry, I was too busy typing stuff to people.
So it
I'm
seems
reading
like,
it. I'm just,
yeah,
no, I'm
yeah,
really, I
no, but I'm
wanted
just,
to.
yeah.
So I don't know if this person's a sex addict that they're dealing with. I don't know if this is just a guy. Um, I think part of what this is, at least that strikes me right at the beginning, is that we men have particular things that turn us on, and women have other things that turn them on because we are not the same, and biologically or emotionally. And so, one of the things that turns men on almost exclusively is new content. We love something new that stimulates us. This is why we watch so much porn. And I'm just talking about us, I'm talking about everyone. So when I lust after an image on paper or one in a movie, I'm sorry, Tammy, maybe I don't understand this question.
Well, I'm really confused. I'm trying to decide if he lusts an image on paper more than one in a movie, or vice versa. Like if it's a flat image and it's not,
Oh, I see
like
what
I'm trying to
I get
decide.
this now. I
Okay,
got
thank you.
this. So
Okay.
your husband's lying. And he's saying, oh, no, I don't sexualize those images on the TV. I just sexualize the one in the magazines. That's a lie. That's an addict saying, oh, I was looking at that. Or, that's an addict saying, I really, really want to watch that movie. So I'm going to tell you it doesn't affect me at all. And I don't want you looking at me and questioning me. And so I'll just lie to you. But I think this is a misrepresentation of the truth. How about that? Do you get that, Tammy? Like how I put
Yeah,
that together?
yeah. No, I like, yeah, something does not seem like, to me, it felt like I want to hold on to this. Oh, that one doesn't bother, like, oh yeah, that's really high, but this doesn't bother me at all. It's like when people are going, oh, the TikTok or Instagram or, whatever it is, those aren't porn. Well, yeah, they can be.
It can be.
So yeah. So, um, and part of it is, if he's working on having a better relationship with you and it makes you uncomfortable, that's a really good place to start. It's like, well, this makes me uncomfortable because I'm not able to distinguish between the two. So like talk to your sponsor, talk to your therapist. But to me, this would be, problematic behavior and should be really looked at carefully. So here's another, this is a tangent, but like people that look at a lot of porn, it gets stuck in their heads. And so, and some of them can have that recall with that. So it's challenging to figure out, how do you stay present and engaged in, with real people and not be sexualizing or objectifying, whether it's an image or something, a recall thing. So yeah, I don't trust that he's telling the truth. How's that?
Yeah.
Okay.
I
go ahead.
Go ahead. No, go ahead. It's okay.
Okay.
I would say to you as a spouse, because Tammy said this earlier, I'm sorry, I really want to reinforce something you said. I've worked with men who don't have a problem with porn. They're just in a relationship and their spouse objected. They didn't feel good about it. And I've had these men say, what's the big deal? I look at porn and lots of people look at porn and, my spouse is being too conservative. And the answer is, and Tammy said this, the person you love the most is disturbed by something. It doesn't matter whether it's the color of your car or the fact you look at porn or the job you have. If your spouse is unhappy, pay attention. Don't fight for I understand this, believe me, don't fight for the expensive car. If your spouse doesn't feel comfortable for it, buy the cheaper one. Don't fight over what images are okay or not for you. Look at what makes your spouse comfortable, not because you want to make them feel comfortable and you want them to feel like what they say matters to you. So I wouldn't fight for, and Tammy and I say this all the time, and I did a podcast with Dr. Stan Tatkin, but he says, if you're making a choice and you want it to be a good one for the two of you, don't make it on what you want. Don't make it on what you think they want. Make your decisions on what you think is best for the relationship, and that will save and solidify and grow your relationship. So right here, what is the best choice for you to make as the viewer? Is it best for your relationship that you try to subdivide what is what, or that you say, based on being best for my relationship, I don't think my spouse really likes this. I'm going to change. There shouldn't be an argument. This isn't about morality. This is about coupleship. But anyway, thanks, Tammy, threw that out for me.
Well, and not looking for another, well, what else can I use? lean into your therapist, lean into your sponsor, lean into your peer group. So, okay, I found out through our formal disclosure that my SA husband had oral sex with several boys in his teen years. He said none of them had girlfriends, so this was the way they could have sex. Is this typical for an SA? He says he's not attracted to men, and his porn use was of women, not men. He's doing all the recovery work you guys recommended. I appreciate you adding that on, so thank you.
By the way, Tammy, I want to say, with all due respect, when I saw FD, I thought fire department. I found out through our fire department. That's like, so just to say, so I don't know how often this happened. I don't know how old he was. I don't know what was going on. So I don't have enough, at all enough information. I can only tell you a biological fact or a psychological fact, which is that young boys, perhaps 14 and younger, maybe 15, and well, I would say 14 and younger. It's somewhere right after puberty, 13, 14, 12 in there. Boys, they used to use this term circle jerk. Boys would sit around and masturbate. One boy would teach another boy how to masturbate. Boys would look at porn together and sometimes masturbate. I have heard the oral sex piece as a part of that. So are boys being sexual? How do I say that? Is it true that boys being sexual with each other at a young age means anything for adult life? And I would say not necessarily, but if your spouse is a sex addict, I would want to know where, how many kids, how many times did it happen, how old were they, all the same age, did someone make someone do anything? I mean, there's so many therapy type questions here, but I would say that just the general question, do boys have sexual relationships with each other in their young teens, and does it mean anything for their adult life? Actually, no.
Well, and that is really helpful. But I also was thinking, how I want to validate your feelings about how confusing that had to be to learn about that in your formal therapeutic disclosure. I hope you had great support. I hope that there was a plan for all of this. But I also understand the wondering about what does this really mean. We had lots of phone calls, and emails about what does this mean if he's had sex with other men, so I honor that you're asking the question. I hope you've had good support and you're finding a healing path now that you've completed the formal therapeutic disclosure too. So, okay, next question is, recently my SA partner's brother intentionally triggered my PTSD by playing a song he knew was a trigger. I asked him not to, please don't play, it's a trigger for me. He said, don't tell me what to do in my own house, and laughed at me, saying it's a good song. My partner admits his brother is a misogynist. My partner was asleep on the couch at the time. The argument escalated, so he woke up in the middle of it when I knocked over an ashtray in anger after my brother-in-law called me the C word and a bitch. I'm not going to, but I'm sorry. My PTSD was diagnosed after walking in on my SA partner cheating, but has roots in sexual assault at 16 years old. My partner says he can see both sides, which I find kind of offensive, but I also don't want to insist on creating any sort of rift between him and his brother. How do we navigate a situation like this? What is a reasonable amount of respect and support to expect from him in situations like this, when I'm obviously not a super proud of my behavior either? So,
Tammy, well, you want to give that a good start? And actually, I got a little restroom, so this is great for you to start.
Yeah, well, so there's so much there. So I have learned for me that there are certain people that are not safe for me to be around. Some of them have familial labels, like, in-laws and things. So I choose. I have learned that I have a choice in this. Now, if your husband and his brother want to be, in close proximity, all good. But maybe you choose to do something else rather than being in the same house and his house. It's very challenging because you are at his house, so his house rules. I say this often. I only have control over my actions and reactions. You were triggered. I get it. You're not proud of your behavior. It happened. If it would help you to clean up your side of the street, then perhaps you do that. But I would honestly look at, is this a safe relationship for you to be part of? Do you need it? Is it a good person for your husband to be as connected to? I don't know. I think it's one of those things where you really need to explore, what does this person mean in all of your, family life, and, how close do you need to be with that person? But yeah, I mean, what is it? If you sleep with the dogs, you're going to get fleas. It's one of those things too, with like, if he's hanging with his brother, I don't know. I'm sorry, I'm babbling, but it's hard because I'm sure he is my brother. I feel, torn and all that, but you are his primary relationship. So at some point, I would be wanting I need to be supported in this. And, your brother was being an a-hole. So I don't know. That's challenging. And it rubs on some personal issues for me. So anyway.
Well, I just want to say, Tammy, it's if you lie down with dogs, you're going to get fleas. And the reason
thanks.
I said that is because sex addicts don't necessarily sleep with the people we're with.
Yeah, that's true.
We just
too.
lie down with them if we lie down with them. So I'm just giving you a hard time. So I agree with, so how do I say this? I can understand, and I'm being kind in a situation I don't know about. But rather than, I completely understand that you said, where was it? That you found it offensive that your husband kind of said, well, you both have a part in it. And I can understand also, and I really want to be respectful, but if he woke up, if your husband woke up to flying ashtrays, while you say, I understand part is my part, well, you have a part. And so, if I were your husband, I would have a difficult time. I'm sure my brother said something to piss her off. I'm angry at him, but then look what she did. I'm angry at her. So I probably would do my best to say, I love you both, and you both have a part in this. So as a husband, I don't think he did a bad thing, but I can understand he didn't support you in the way that you wanted him to. I get that. My actions are not necessarily going to mean anything to anyone except me. So if I say to my husband, I really don't feel comfortable around your brother, and it's okay if we go to Thanksgiving when there's lots of people around, but being just one on your brother, or staying, and I don't care if you see him every other day, you have to take care of yourself. You have a PTSD, you have an abuse history, you were assaulted as a teenager. I'm sure I hope that you're really working on yourself, or you have worked on yourself to come to peace with that. And, here's the deal, sister, you got to put yourself first. And I would not be concerned about my husband's relationship with my brother. What I would say is, I really love you for being engaged with your brother, and I really hope you have a great time together, and go to the ball game, do whatever you want. But it's really better that I'm not involved. And if I am involved, it needs to be like a family thing. Now, if he gets mad at you about that, what are you going to say? I'm not going to let myself sit in a very uncomfortable situation to please you. I know that you love your brother. I respect that. I'm not going to try to get in between you, but I don't have to be there. So this idea that you're going to create a rift, this is between you and his brother. If your husband steps in, I would say to him, could you let me handle things with your brother? And my decision is Thanksgiving only. And because you have to take care of yourself. And by the way, as an assault and abuse partner, history, someone with that history, it's very hard for us to stand up for ourselves. It's very hard in a situation like this to say, this is what I need, this is what I want. So good for you for being able to articulate that you don't like something and stand up to a situation, which I think as a survivor, it's easy to just collapse into. So now you got to follow through and set boundaries. And if you aren't sure how to do this, well, this is a great thing to go to one of the betrayed spouses groups, or we teach a betrayed partner course, and say, I need information from other people about how they deal with this. My brother and my brother-in-law are sex addicts, or my husband, and you're not the only person who has to deal with issues around your kids, your spouse, this affects the whole family. And so I really encourage you to just stop in and get support. There's no charge. You can get support from these folks, or you can take a betrayed partners course, and that's how you kind of negotiate your way through, learn things, and grow relationships with those women. But you need support here for yourself to not get angry, but to hold your line.
Yes, and holding your line. But I had this heart feeling too with I'm in a place, I'm asking this person not to do the things that are the most triggering for me, and not only did he not stop, but he was laughing and making it worse. And so that had to feel like an extra assault. And then, and I'm sorry for you with that, but like, just know that you're worth holding healthy boundaries for you. And I don't have to be around people who are unsafe for me. And it sounds like, this person is for you, maybe not for your husband, but for you. So,
Yeah, and I want to add
okay,
one
go
more
ahead.
thing at that, which is you said his brother's a misogynist. I think his brother's mean. That is a mean thing. Forget whether you love women or you. If someone said, I'm really uncomfortable with something, and you say, I don't care, I'm going to do it anyway. I don't care whether you're talking to a man, a woman, or a dog. That just isn't okay. And so, what I would say to you is, your brother in law is mean to you. And that's not okay. Forget his views on women. He's mean. And I don't want to be around people who make choices to be mean to me. Tammy, what do we got next?
So the next one is, would you say it's the same risk factor for stepdaughter, stepfather pornography? And
Well, there
that's,
was a question before that.
well, but it's yeah, but it's not a question. It was just a statement. So,
Well, trickle disclosure, since he left treatment, he said it's something he didn't disclose. Again, just to that part, I would say, why didn't it get disclosed? And why was that the last thing? And again, it makes me uncomfortable. I will just stick with that. It makes me uncomfortable. And
well, and how do you know it's the last thing? Because it could be the last thing for now, and then there could be another last thing. So, and then, yeah. So,
and is the same risk factor with stepdaughter, stepfather. I don't care. Incest porn is incest porn. That word makes me uncomfortable.
mm-hmm.
And I have to tell you, it's not unusual for me to work with people who they know things happen to them, but they really don't know the effect it had. And they were really not in touch with the feelings around it. So, your spouse may say, oh yeah, look at this kind of porn, but there may be much deeper issues underneath it for him. But yeah, I don't care who's having sex with who. If you're related, it's a problem.
Yeah. Yeah. Okay. So the last question. Hello, I've been doing recovery group and individual since May of 2020. Did PA 101 was great. Need to add 12 step. I agree. My slips have been what Scott B calls not porn. It seems so easy to be in denial about non-nude images, though they were certainly not healthy. Do you have any advice? What not porn is middle circle being discussed with therapists, and what is inner circle being discussed with partner? Inner circle equals sexual reaction for me.
Yeah, I could not support your treatment plan. First of all, I don't think inner circle means anything about feelings. The inner circle, which for those of you who don't know, is sobriety. Because in AA, you say no drinking, no using. It's pretty clear in our program. And with eating disorders, we don't want you to stop eating or stop having sex. So we help you define sobriety. And the inner circle, I'm making a little circle here, the inner circle is the bottom line. If I cross this line, I've had a slip. I looked at the porn. I went to the massage parlor. I called the affair partner. It has to do with action. And so I would never encourage putting lying or thinking about things or things that I wouldn't want to throw away a year of sexual sobriety because I lied to someone. I wouldn't want to throw away a year of sexual sobriety because I lusted after someone. I mean, those are things we can work on for a lifetime. So this is just a separate issue. I really, really, and I know you spouses, I get it. You want anything we look at, anytime we have a feeling, you want to know, and you're going to get angry and it makes you feel safer. But it's not our job to tell you every single thing that comes into our head. And if we do, then you're not our spouse anymore. Then you're our parole officer. And who wants to make love to or be in an intimate relationship with their parole officer? They usually tend to resent them. So I do think that when you do your inner circle and it's up to you, you'll never get time together if reacting is the thing that is a problem. Okay, I want to go back to the actual question. Yes, I have a lot of men coming into treatment now, and it's interesting, Tammy, who say, I was just looking at Instagram. I was just looking at that page on Facebook. You know what you're looking at. And by the way, everybody at Seeking Integrity, when I turn to them and say, really, is it just Instagram? They know exactly what I mean. So I don't think that it is easy to be in denial about non-nude images. I really don't. If it is something that is sexually arousing to you, it's a sexual image for you. And by the way, there are things I look at that kind of don't interest me, and there are things that other people look at that are extremely arousing. This would be something I would talk about. Any advice about what porn is not being? I would talk about in my therapy. I would talk about it with a 12-step recovery person. And most of all, I talk about it with my partner. What is it that makes you uncomfortable? Because I want to follow that rule. I'm not going to call it a slip, or I am, but I'm not going to and I'm not going to report it to you every time, but I really want to know, what is it that you might see me looking at that will disturb you? I think if you put your spouse in your attic for a minute, and you have attic, and you have them looking out at what you're looking at, you'll know pretty quickly. And if it disturbs your spouse, you probably shouldn't be looking at it. It's not really that hard. I don't want your spouse to be your guide over time, but at this point, if something is bothering them, you need to ask them so that you can be clearly guided, and you need to ask your sponsor, and you need to ask your therapist. So, boy, I said a lot, Tammy. Do you have any other stuff to add?
No, I'm just affirming the need for 12 step, because I'm glad you're doing group and individual. I'm glad you did the work group, and right. You did PA 101. I don't know if you did level 1 and level 2. Highly encourage both, but yeah, we have other things like the attachment wound and inner child. All of those things help you continue to look at I wonder why I do this. What am I looking for? It doesn't fix it, but it helps give you names of like, oh, I'm feeling abandoned right now, so I'm going to go, I want to go do this, or I want to look at these not porn, so there, it's just a lot more that you can do. But yeah, 12 step is like, there's lots of opportunities and groups. You can't have a sponsor if you don't have the 12 step group. So lean into all of that, and keep coming back here.
Can I add one quick thing before everybody goes? We have 47 people in the room, and earlier we had 52 or 54. I just really want to validate and thank all of you for coming here and trying to work and improve yourselves. The last thing I want to do is go spend an hour listening to me and Tammy talking about really painful and difficult things. Mm-hmm. The fact that you're just here. And yeah, we talk about the different programs and stuff we do because, I've been doing this 30 years. And if I set up a course online, it's a good course. If I set up, if Tammy works on someone on the 12-step video, it's a good video. We've been at this for decades and decades. So whether it's free or cost, or whether you just come here, I just really, really want to acknowledge that this is hard stuff and you are hitting it head on. And, that's really the only way to do it. And even your complaints, your disappointments, your hurts, you're bringing them to us. I so appreciate that. And I become better at what I do just hearing that. So I just wanted to do some props for the people who come here so often.
Yeah. And I want to give hope. I mean, I see this consistently. I love our treatment program. There is no better clinical team. Dr. Rob works directly with the clients. It is life-changing. They only have them for a short time. And as somebody shared, they still held back. And they are talked to about that all the time in treatment about, our secrets keep us sick, but that's what's going to make us relapse. So if we want, we want the benefits of recovery, we have to be willing to do the work. And so, yeah, I honor too that you guys are here with us on Monday nights. I think next week is Labor Day and we'll still be here. So
yes, we'll be laboring.
Yes, there you
thanks,
go.
Tammy,
so thanks
for the
everybody.
Work, and hopefully we'll see you guys soon and listen to the podcast.
All right. Thanks everybody. Bye.